Our brains work by a carefully orchestrated system of neuronal signals. Seizures occur when there's a mass firing, when there's a malfunction in the system. Usually it will cause a sudden, excessive, uncontrolled electrical signals passing through the brain. There are several different types of seizures. Classically, the Grand Mal Seizure causes the type of thing where people are writhing on the ground because all the muscles are going at once. After a Grand Mal Seizure, a person will usually wake up after a minute or two. They'll lose consciousness and wake up and be very confused. They may have urinary incontinence. They may bite their tongue. Never put anything in their mouth. Never put anything in a person's mouth who's having a Grand Mal Seizure. That's a myth. They can't swallow their tongue. You'll just hurt them and you can break a tooth that way. And even if they do bite their tongue, those bite marks will heal quickly. Now, if you should witness somebody having a Grand Mal Seizure, just be sure they're comfortable. Lay on the ground, a pillow around them if you can. Remove any sharp or hard objects so they don't hurt themselves during the seizure. Another type of seizure is a focal seizure. And a focal seizure, instead of the whole brain firing, just a little part of it. And you can see things like an arm shaking, or mouth grimacing, or funny smells, or a sense of something crawling on their arms, because just a part of the brain is having that seizure. Another type of seizure is called an absence or petit mal seizures. And in these seizures, the child, usually a child, will have like a staring spell or a blank spell. They won't faint, but they'll be unaware of what's going on around them. These usually last much less than a minute, and the child will have no memory of having this event. They're not harmful, but they're sort of peculiar to see happen. Another type of seizure that affects mostly children is the febrile seizure. Now, the febrile seizure, the child either has just had a fever or has some type of illness which is causing the fever. This occurs almost exclusively between the ages of 18 months and 3 years, and it does not predict any type of long-term seizure disorder. It tends to run in families. The treatment is just give them fever control and, of course, find out if they have an infection that needs treatment. Almost all seizures will last less than a minute. If a seizure lasts more than 2 or maybe 3 minutes, best call 911. The person may have trouble breathing, or there may be some other issue going on. Nowadays, seizures can be well controlled with all types of different medications. So if you know someone having a seizure, or if you have a seizure disorder, be sure and consult your physician. This has been Dr. Philip Levin with the Short Medical Videos.